I'm Allison Kukla. I'm our Senior Manager for Programs and Partnerships here at the Foundation. I'm in Chicago and I'm a person with epilepsy, and I'm your moderator tonight. I'm really excited to have all of you joining us. The topic for tonight's discussion is going to be focused on Hopscotch, which is a self-management program that helps adults with seizures find ways to manage and cope with memory and thinking challenges to improve their quality of life. It's a really great program. I've done it myself before. I have a wonderful panel with me tonight. You can see there on the screen, including Hopscotch community members Scott Wakefield and Joanne Kleinman, Hopscotch coach Dr. Lisa Sackman, and the director of the Hopscotch Institute at the Dartmouth Hitchcock Epilepsy Center, Dr. Elaine Kirakopoulos. We're going to start tonight by hearing from Dr. Kirakopoulos. She's a graduate of the McMaster University Medical School in Ontario, Canada, and she completed her neurology residency and epilepsy neurophysiology fellowship in Boston at the Beth Israel Deaconess Medical Center and Harvard University. She also serves as a member of the Epilepsy Foundation editorial board. I want to welcome Dr. Kirakopoulos, and I'm so excited to have all of you with me. And I'm going to turn it over to her right now to start our discussion on the Hopscotch program.
Thanks to all who have joined, and thank you to Allison and the team at the Epilepsy Foundation for welcoming us and allowing us to share a little bit about our Hopscotch program. And tonight's webinar was titled Building Skills to Manage Cognitive Challenges and Improve Quality of Life. And so we're going to start out and I'll share a little bit about the program and some of the cognitive challenges that can occur with epilepsy. And then Dr. Sackett, Scott, and Joanne will share with you their experiences with the program. And I'm most excited for you to hear from them. So let's get started. We have a lot to get through. So I want to just take a moment to acknowledge the Managing Epilepsy Well Network, which is funded by the CDC, that helps for the development and the testing programs like Hopscotch. And also to say thank you to our partners at the Epilepsy Foundation. And you can always access information about Hopscotch and other self-management programs through their helpline. And so here are my disclosures for today's presentation and the learning objectives that we'll try to focus on for the time that we're together. We'll talk a little bit about the effects of epilepsy and treatment for epilepsy on cognition. We'll talk about participating in an epilepsy self-management program, and tonight we're going to focus on Hopscotch. We'll discuss problem-solving therapy and memory strategies. And we'll talk about targeting solutions and building skills to take control of day-to-day life. And so we know there are some key factors which affect cognition in epilepsy. And those include seizures themselves, sometimes the underlying cause of epilepsy, sometimes cognitive memory and thinking challenges can arise secondary to treatment for epilepsy. And other times, comorbid disease can have an influence on people's cognition. One thing I want to make clear is that epilepsy syndromes we know are diverse. Everyone's journey is not the same. We know that clinical outcomes in epilepsy are diverse. And so I want to emphasize that we're talking generally tonight and that cognitive profiles in epilepsy are also diverse. Now, with that said, we also know that there's a real need to address cognitive challenges when it comes to epilepsy. And I'm sharing with you here some results from a survey of 425 people living with epilepsy that was done by the International Bureau of Epilepsy. And what you can see in those percentages there is that a great number of people report difficulty with their learning and thinking, with side effects like getting tired or sleepy, perhaps related to their medication, and some difficulty feeling like their anti-seizure medicine side effects prevent them from achieving their goals. 61%, so 6 out of 10 people stated that they'd ask their healthcare professional if their cognitive side effects can be reduced or improved. So you can see this is a very common problem. And we know it affects both children and adults, and that when we compare people living with epilepsy to the general population, you can see more than twice as many have difficulty when it comes to memory and thinking. And this is complicated, of course, by a wide variety of factors, and we'll talk about some of those tonight. The other important thing I want to emphasize here, and the reason why programs like this have come to exist, where people have worked hard to develop and test them, is we know that if someone is having difficulty cognitively with their memory, with their attention, with their thinking, that this tends to be a predictor of how they evaluate their quality of life. And so it needs to be addressed because we want people living their highest quality of life as much as possible. And so when we're talking about cognition or thinking, what are we talking about really? And so cognition's a big umbrella, and we're going to focus a little bit on memory and attention tonight, as well as planning and problem solving. But you can see all these different aspects of thinking can come into play when we refer to cognition. And so if we hone in a little bit on memory problems, and we ask people with epilepsy and without epilepsy, tell me what you mean by memory problems. We hear all kinds of different answers. For some people, it's misplacing things. For some people, it's difficulty at school. For others, it's difficulty navigating and driving. For others, it relates to their health and their ability to manage their disease, like taking their medication. And so when we divide up these different memory challenges and we look closely at cognitive symptoms, for some people, they really report that their main difficulty is remembering. So things like forgetting appointments, forgetting names, conversations, forgetting to take their medicine, forgetting what tasks they've completed and what they still need to complete. And for others, they describe it more as an attention difficulty. So having a hard time focusing. If they're reading information, they may have to go back and reread it. Or if they're doing a task, they might walk away and leave the task unfinished. Oftentimes, they'll share that they make mistakes on simple tasks or that they miss details or skip steps. And it's common when someone's having this sort of difficulty for it to show up at work or at school. Now, for other people, when they talk about difficulty with their memory, they refer to things like planning and organizing. And in this case, people share that they have difficulty planning their time or organizing their day, difficulty scheduling important tasks. And I've listed here things like paying bills or car maintenance. That multitasking is difficult. So if they're trying to do a lot of things at once, they have trouble with spontaneous or new issues that arise. And often they'll express feeling overwhelmed. So you can see, while all of these can be related to memory, there's some difference in the symptoms that people share. One thing I'd also like to share with you this evening is that the correlation between the self-reported memory problems that people have and neuropsychology test results are low. And many of you may have undergone neuropsychology testing. Your neurologist may have sent you to do some tests if you've shared that you're having trouble with your memory or thinking. And so when we compare what people report subjectively to what research shows, we'll look at this chart and see how things can vary. What do I mean by saying that the correlation is low? So patients and caregivers might think that a person's memory is fine, but research has shown us that those who feel they don't have impairments often will be the ones who have the most impairment. Sometimes patients and caregivers might share that their epilepsy or treatment has significantly worsened their memory or concentration. And then they go on to do neuropsych testing. And often, those don't turn up on testing. And it doesn't mean that they're not having the problem. It just means that the test is not correlating. For some people, they might report they had memory problems before they ever had a seizure. And research shows us, yes, in fact, memory problems can exist before seizures begin. People will share that they can't remember what happens during or right after a seizure. And we know that seizure activity affects memory, but exactly how is not still perfectly understood, although we're learning more and more with research. Some people may share that the longer they've had epilepsy, the worse their memory and concentration have become. And research shows us that memory can worsen with prolonged epilepsy, especially poorly controlled epilepsy, so people who have frequent seizures. And then finally, they may share that their medicines make it more difficult to remember and concentrate. And there are many anti-epileptic drugs have some effect that have some effect on memory. But this tends to be less true when we look at the newer drugs. And so I want to talk a little bit about causes and variables that can impact someone's cognition, their memory, or thinking. And I've divided it into 4 different categories, and I have a little umbrella for each of them because we're talking very generally here, and I've just listed some examples. Some of the things that make trouble for cognition, for memory and thinking, are things that are largely irreversible, and they tend to be structural things. So if someone has a lesion like a tumor, or if they've had a brain trauma where an area of the brain was injured, that's important for cognition. That can be hard to reverse. Or if someone's had epilepsy surgery, and as a result of the surgery, which can sometimes happen, this is not everyone, but if someone shares that they have memory trouble after surgery, it could be related, it could be structural. There's the possibility it could improve over time. But for structural changes like that, we consider these things to be largely irreversible. There are also clinical factors that come into play. So where a seizure focuses, how long someone's had epilepsy, the different types of seizures they've had, if they've had repeat bouts of status epilepticus or a long course of status epilepticus, this can sometimes be something we need to consider. Now, there are also largely reversible functional factors to consider. So things like medicines. So if a particular medicine is causing trouble, oftentimes in talking with your doctor, they may switch the medicine, switch the timing of your dose, or switch the amount of medicine you're taking. If someone has psychiatric comorbidities like anxiety or depression, which can often be present in epilepsy, if they're not being treated, by treating those difficulties, oftentimes we can see an improvement in people's cognition. Then, of course, seizures. So we want to, achieve as best seizure control as possible to limit the number of seizures someone's having, and the abnormal electrical activity that occurs between seizures. And then in the final column here, I have things that are modifiable. And this is where we can take action, and where a program like Hopscotch can be very helpful to your medical care as an adjunct. And so things which are modifiable are things like sleep and nutrition, fatigue, how we deal with stress, what our schedule is like and what our pacing is like throughout the day, and what distractions might be present. I'm going to talk just a little bit now about anti-seizure medicines, because we know that there are some differences among them. And as I said to you, relatively favorable are ones that sort of fall in the newer category versus less favorable, which tend to be some of the older medicines, and you can see them listed here. And I want to provide the caveat that this is not the same for everyone. So like everything else about epilepsy, this is very individual. So for some people, one drug may cause cognitive problems, and for another person, perhaps not. So this is just sort of a general idea here that I'm sharing with you. And then I mentioned earlier about how cognition might be impacted before anti-seizure medicine has been started. I'm sharing with you here a study that looked at 247 people who were newly diagnosed with epilepsy, who had not yet begun treatment for their seizures, to assess for cognitive problems early in the course of epilepsy. And when that group was looked at, about half of them had memory problems and about half of them had attention or executive function problems. And this is before they'd taken any medicine. And also interesting, in that group of about 50%, if you looked at just that group, the people who were having trouble, 1 out of 2 of those people were unaware of the difficulties that they were having. And what was learned by studying this group was that there was a higher risk for cognitive challenges if people had generalized tonic-clonic seizures, if there was some sort of underlying lesion as the cause of their epilepsy, or if educational level was lower. So 2 key points here to take away from what I've shared with you so far. Is neuropsychological testing can be helpful, and doing it early in the course of a diagnosis of epilepsy is something that people should discuss with their doctors and their nurses. And the thought that anti-seizure medicines can also have a positive as well as a negative effect on cognition. So if someone is having frequent seizures and they get placed on a medicine which helps to control those seizures, then it's easy to appreciate how that might benefit their cognition. So it's not always a medication side effect that leads to these cognitive issues. So you're thinking, what can I do to help improve my memory and thinking? And so some of the things listed here are things that hopefully you're aware of and maybe doing already. So monitoring your seizures and seeking treatment for uncontrolled seizures. We know it's important to do that. Talking to your doctor about clinical and subclinical seizures. And what we mean by that are seizures that you're having that are obvious to you, and the possibility that you might be having some that aren't so obvious to you, because those can also impact cognition. Managing and treating comorbid disease, and I gave you the examples of psychiatric comorbid diseases, which are common in epilepsy, but this goes for all medical disorders. So things like diabetes, for example, can impact cognition. If someone has a fluctuating blood sugar level, for example, that can also have an impact. And it's important to not only think about epilepsy and seizures, but if someone has a comorbid illness, to think about making sure all the different disorders are well managed. Anti-seizure medication adherence is critical, and we know it's critical to help control seizures, which hopefully will also help to lessen cognitive problems. Speaking, with your medical team about polypharmacy. So if someone is on a lot of medication or taking prescribed and over-the-counter medicines, is there any way that that's contributing to cognitive difficulties? And then taking care of general health and fitness is always important. And then finally, something you can do, which is accessible to all, is to participate in a self-management program like Hopscotch. And so let's talk a little bit more about Hopscotch. And Hopscotch stands for Home-Based Self-Management and Cognitive Training Changes Lives. And so this program was developed and tested at Dartmouth by my colleague, Dr. Barbara Jobst. And she developed this program after recognizing that patients in her clinic needed help that went beyond the clinic with some of these cognitive issues to help them live more productive and happier lives. And so she worked to develop Hopscotch with her fellow, Dr. Tracy Collar at the time, and a multidisciplinary team. And there are several epilepsy self-management programs, and I have them shared here over in the left-hand column. And so if you're thinking, you're not familiar with self-management, what is self-management? Epilepsy self-management are is using different processes to control seizures and manage the effects of epilepsy. And these programs tend to involve things that revolve around medication and treatment, so managing those, managing seizures, and also managing lifestyle. And the approaches that are used in these programs come from other models of chronic disease management where patient benefit has been seen. And in self-management, there's a partnership that exists between the person with epilepsy, their provider, and their family or other support persons in their lives. And this is an adjunct to medical care. It doesn't replace any clinical guidance you might get from your providers, but it's an add-on type of programming that can be really helpful to people. And the strategies for these programs are grounded in proven behavioral science approaches. So they're sort of tried and tested approaches that we know can help people to better manage disease. And in fact, we know looking at the programs that have been developed and tested, that people who participate in these programs can experience an improvement in quality of life. They can become more knowledgeable about their disease. They can improve their management of both their disease and their lifestyle. They can feel more self-efficacy, and self-efficacy is that feeling that you have control over something. We can see improvements in mood, and for some people, seizure frequency as well. And so Hopscotch was developed as an evidence-based program for adults with epilepsy, and it's designed to help treat cognitive symptoms, to improve quality of life, and because of how it's delivered, minimize barriers of access to care, and to provide one-to-one cognitive coaching support. And you'll hear from Lisa and Scott and Joanne about how this relationship works throughout the program. And so you're thinking, all right, so far, sounds good. How does this happen? Well, Hopscotch is a telehealth accessible program, and you can connect with Hopscotch through our website, hopscotch.org. You can reach out to the Epilepsy Foundation helpline or your local epilepsy foundation to connect you as well. So you'll connect with us at the Hopscotch Institute. You'll speak with our program coordinator, and we'll be sure that the program is a good fit and the timing is right for you. And once that happens, you'll be sent out a packet of materials, and you can see them over here on the left. And there's no cost for the program, and there's no cost for the materials. They get shipped out to you. And then you'll begin the program, which consists of 8 weeks of one-on-one coaching. Each session is roughly an hour long. And you'll meet with your coach, and they'll guide you through each of the sessions. And you can see what the target is for the majority of the sessions. In the first session, which is currently being done virtually, you'll meet with your coach, and they'll do some education with you around memory and seizures, and they'll introduce you to problem solving as well as mindfulness through quick relaxation exercises. From there in forward, from sessions 2 through 7, you'll really focus in on something called problem solving, and we'll talk a little bit more about that, and implementing memory strategies. And when you wrap up at session 8, you'll form a maintenance program with your coach so that you can carry these skills onward in life, so that the benefits extend far beyond the length of the program. Now, I mentioned to you that Hopscotch is evidence-based, so I want to share with you briefly that it's been tested in 2 randomized controlled trials and shown to provide improvements in quality of life and cognition. If anyone wants to do more reading on this, feel free to reach out to us, and we're happy to share these resources with you. So it has been tested in 2 randomized controlled trials and shown to be beneficial. And I want to talk now a little bit about the core program components for Hopscotch. And they include epilepsy education, self-awareness training, problem-solving therapy, compensatory memory strategies, and mindfulness. And so if we think about epilepsy education, when you meet with your coach one-on-one, they'll discuss with you a little bit about your epilepsy. So you'll be educating them as much as they're educating you about the types of problems you have, the type of seizures you have. They'll share with you around the anatomy of seizures and cognition, so that you can learn together how you may be impacted by your epilepsy and how that might be impacting different types of memory. You'll also talk about what's necessary for memory to function. So we know to make a memory, you have to be able to get information in. So that's encoding. And in this example here in the pictures, it's the information in that yellow folder the gentleman's holding on to. So once that information comes in, the next thing that needs to happen is it has to be stored. And that's what the filing cabinet represents. And then finally, a person has to be able to retrieve that information. So go back into that storage cabinet and retrieve the information. And for a lot of people, retrieval tends to be the area where they struggle, and it can be really frustrating. The second component revolves around self-awareness training. And what I want to share with you is that the program is very participant driven. It's very individual, so you get to decide what challenges you're having and what you want to work on. And that's the sheet shown over here on the left. You'll think about with your coach and share with your coach the different organizational skills that you're having trouble with. If you're having challenges around disease management or social skills, you'll share those as well. So you really have time to stop and think about where you're having difficulty. And one of the exercises you'll complete between week 1 and 2 lets you look for patterns in underlying memory or thinking problems. You'll be given a sheet like this in your workbook where you go off and you think about as they're happening. So you'll record sort of what type of difficulty you're having and how much it bothers you. You'll think about what was happening around you. So external factors that might be influencing you, as well as internal factors. So what were you feeling at the time when you had trouble remembering or thinking? Were you anxious? Were you tired? Were you hungry? And together with your coach, you'll look for patterns and you'll try to approach those things and solve those challenges so that it's less likely that you have those cognitive challenges recurring. And the mainstay of the program really revolves around problem-solving therapy, which you'll work on from weeks 2 through 8. And problem-solving therapy is a type of cognitive behavioral therapy, and it's based on a model of stress and well-being. So this was developed initially by a primary care physician in the UK who wanted his patients to see problems that as challenges that could be solved instead of insurmountable obstacles. You know, he really wanted them to be able to systematically work through the challenges they had by using creativity and skill building and demonstrating effectiveness through this technique. And so there are 7 steps to problem-solving therapy. We're not going to spend a lot of time. You can see them outlined here, but essentially you as the participant will decide what problem you want to work on. You'll set a goal with your coach. You'll brainstorm solutions and consider pros and cons, and choose a solution that you'd like to use for a week to see how that works. You'll develop an action plan. You'll come back the next week and you'll review with your coach how things went. And you'll do this over and over again, and people get really, really good at this. And they're able to then take these 7 steps and apply them to their life well beyond the length of the program. Another component of the program is we arm you with something we call our memory toolbox. And these are tried and true strategies that people can use and apply in life from day to day to help boost their cognitive function, to help them with their memory, with their attention, with their thinking. And so your coach will teach you each week about these different strategies, and you'll have the opportunity to test them. And finally, the 5th component of the program revolves around mindfulness. And you'll learn quick relaxation exercises with your coach that allow you to participate in something called progressive muscle relaxation, where you can remove stress and tension from your body, as well as how to implement deep breathing exercises to help lower stress and help you function at a higher level cognitively. And so I've shared a lot with you all. about the evidence for hopscotch and some of the key points around the program and its core components. I'd really like to share with you that we're all so enthusiastic about this program because we hear from people who participate how much it's meant to them. And you can see here some quotes from some of our past participants talking about how helpful the program was to them and how it was life-changing for them in many ways. And so we're really motivated to continue to share this program because we know that people find help through the program, and we're happy to do it. I just want to share thanks with our Hopscotch Institute team who make our ability to share this program possible. We have a really dedicated team that you can see is multidisciplinary that works to make sure that whoever wants this program is able to receive it. And with that, I'm going to turn things over to Allison and our esteemed panel to share with you their experiences.
Just thank you for all that great information. You've got a couple of questions in the Q&A box. If you want to type those answers while I talk with the panelists, that would be great. We want to make sure we get those answered. But as we shared earlier, we have a Hopscotch coach with us and 2 Hopscotch community members with us. So we have Dr. Lisa Sackett with us, who is a Hopscotch coach. And we also have Scott Wakefield and Joanne Kleinman, who have both participated in the Hopscotch program. So thank you all for being with us. We're going to talk with them about their experience with the program and how, it is, how they, enjoyed the program, what they learned from it, and with Dr. Hackett, how it is being a coach. So if you have questions for them as we're talking, please share those questions with us and we'll get them answered as I ask them some questions I have for them to start off the discussion. So I want to start with Dr. Sackett. What's the role of a Hopscotch coach? I know some people might be curious. I know Elaine touched upon that a little bit.
It's a great question. Thanks for having us today. The Hopscotch coach has a couple of different roles. We are educators about epilepsy, about memory, about attention, about problem solving. We are supporters for our participants who in some ways struggle quite a bit and in other ways don't struggle much. And we need to learn about those experiences for them and support them in finding solutions to the challenges they face. We are guides for the program. So we are trained and certified in program delivery. So all of those roles are important, equally important. I hope and believe we are warm, empathic listeners. The one-on-one relationship between the coach and the participant is really central. I think it drives a lot of benefit because we are warm and empathic. We are educators. We are guides for the program, and we can both present the Hopscotch fundamentals step by step and customize where we should spend most of our coaching time. Because for one person, certain issues might be more important. And for someone else, that's not important at all. They want to work on something else. So we get to do a little bit of customizing. The relationship is terrific. I look forward to my Hopscotch hours every week. I hope and believe participants value the hours also. It's really special. And anyone who's considering learning more about Hopscotch, boy, we'd love to meet you.
Well, it sounds like you get a really, like you said, special relationship with the community members that you get to coach. I see some questions coming in already for you, but I want to make sure we talk with the, our community members that are here spending some time with us today. So you can feel free to, answer those questions that have come in, and we'll make sure to get those answers out to everyone if we have some time at the end. But I want to move on to Scott and Joanne, who are with us today, because I know a lot of the community members joining the webinar who might be interested in joining Hopscotch want to hear from you all too, to, what's it like being in the program and all of that. So I want to start with you both, and we can start with Joanne and then we'll go to Scott. Same question for you both. Can you tell us a little bit, about yourself and what your journey with epilepsy has been like?
Sure. I struggled with seizures for about 14 years. I actually was diagnosed originally with PNES, psychogenic non-epileptic seizures, which I do believe I still struggle from. My seizures over time had changed, and it wasn't until June of 2020 that I was diagnosed with epilepsy. I had gone through a lot of testing and I must have had an EEG once a year and never been able to capture a seizure until one night in 2020. So finally, I was able to get to the bottom of what was causing my problems.
And Scott, same question for you.
Same question. Well, I'm 53 years old, and 6 years ago I started having seizures. That was it. No idea why, just started having them. And there's nothing like having a grand mal seizure at your desk, at the office, and waking up with your coworkers looking down on top of you, wondering what the hell just happened. So that started off the diagnostic process of finding out what's going on, and was diagnosed with epilepsy, with left temporal lobe epilepsy, and was able to get the seizures somewhat under control. I still have them. They're much milder now. I know they're coming by about 30 seconds. And so I can get myself into a spot where I'm not going to go crashing down around anywhere. But I don't drive anymore. And because of the impact on my thinking capability and my memory capability, I don't work anymore. So it's been a very frustrating kind of path for me. Certainly not the path I expected. I will tell you that. And one day I was at Brigham and Women's, where my neurologist is. They mentioned to me this program, this Hopscotch program, that I should give it a try because they've heard good things about it. And so with that, I reached out to the Hopscotch program and said I would be very interested and they would be interested, and started talking with Lisa. I believe it was you initially, or maybe it was Elaine first. I can't remember who at first, but then went into did the Hopscotch program and found out it to be a tremendous tool, a really great thing to help me with my memory, to think clearer, and to give me some tools that when things weren't right, I could kind of clear my head and understand why, and try to put things back in perspective. Hopscotch program has been good. I would recommend it to anybody.
You sound like a champion for the Hopscotch program.
I am. I am. It's really been fantastic. The accountability that Lisa held me to. That don't believe that whole empathetic thing that she said there. She's a slave driver. And every week you have to have your homework done. But she is just the nicest person, and really she understands memory issues, so you don't have to go in every week and explain what your issue was that week. She's got the agenda already done. You just follow along, and she helps push you there. So it's good.
So Joanne, Scott shared with us how he got connected. How did you get connected to the program?
Well, I had just finished my neuropsychological testing, and the doctor, the psychologist at the Mayo Clinic, recommended I try this program. And at first I wasn't so sure about it. I was a little nervous, but then just the way I felt with the problems that I had and the memory losses, the short-term memory problems, and finding words as I'm trying to talk to someone, and spelling issues, and you name it, many other things. I said, well, you know what? If I try it, the only thing it's going to do is help. It's definitely not going to hurt. And so I signed up. And I honestly have to say it was probably one of the best things I've ever done for myself. Coming out of this program, not only do I feel as though I can, I still have memory problems, but I feel as though that I can work through things better than I could before. It gave me so much confidence that I could go into a crowd or meet new people and just be able to have a conversation. And honestly, if they don't like what how I say it and what I say, then that's, that's their problem. It's not mine anymore. So I loved Hopscotch. I have to say, I truly do.
Yeah, no, that's great. I love hearing the confidence it has given you. I share some of the same memory problems. As I said, I'm a person with epilepsy, the word finding and things like that. And yeah, being able to have that confidence is, I love hearing that. And we have an audience question. That was one of the questions I was going to ask, and you were touching upon it a little bit. So I want to make sure we ask it, how difficult, or have you found it difficult to maintain the tools that you learned in the Hopscotch program after, you weren't meeting with Lisa to, keep going each week in the program? Have you been able to maintain the tools?
Go ahead, Joanne, please.
So my coach was Elaine, actually.
Okay.
And sometimes now I've been using it for so long that I just go ahead and do it without even thinking, honestly. And I noticed that once I started doing the Toolbox Tuesday, once a month, I feel so good about it. And it brings me back to when we were actually going through the program the first time. I feel as though that just keeps my memory intact and keeps me feeling as though I can do it. And I love the Toolbox Tuesday. To me, that's one of the best parts of the program.
Allison, I can talk a little bit about Toolbox Tuesday.
Yeah.
So after the 8-week, 1 hour per week phase of Hopscotch is completed, all graduates, if you will, are invited to participate in a once a month, 45 minutes, last Tuesday of the month Zoom group where we have two goals. One is to keep skills fresh, which is the question you asked originally. How do we keep skills fresh? And the other is to just build some fellowship and some community, because it's really such a relief to be among people who all understand epilepsy and memory problems and attention problems and all the ways that we can create circumstances that play to our strengths and minimize what's more difficult. So that's a once a month group, and it's drop-in, it's free. And so anybody who's completed Hopscotch is welcome to join us. I co-run it with another coach, and we are delighted to do it. And I'm glad to hear it's helpful. We really enjoy it.
That's awesome. That's great to hear that. And then Scott?
Yeah, no, definitely. Sorry, I jumped in there. The Hopscotch Tuesdays is a good thing. And I was going to say that one thing to the initial question of what happens when you kind of stop using these tools or you forget to use them is I might remember, I'll find myself in a situation where I will remember that I used to be able to do this. I used to have a tool to do this. Whether it's bring a list to the grocery store, which probably would never happen because that's too simple a list. That's too simple of something that I would do. But whatever it is, if I find myself staying up too late at night and not getting enough sleep, and then the next day, not remembering having a real impact, and I'll say, time out, get to bed at a regular hour, sleep till a regular hour, and just dial that one back and do it the right way. Do it what you and Lisa talked about. And that helps.
Allison, if I could share, we never set people free. So they always have access to us even after the program. And that's because as much as we share with them, they share with us. So, we do booster sessions. So if Joanne or Scott were to email in to us and say, hey, do you have an hour for me for a one-on-one as a refresh? We have the coaching capabilities to be able to spend an hour with someone to do a refresh session in addition to the Toolbox Tuesdays, which we set up to build that sense of community and to learn from one another, because it's not only reviewing the strategies, but a lot of learning happens between participants. Hey, what strategy worked for you, or how did you implement this? All that sharing goes a long way. So I just wanted to share that this is not a program that you come to and you leave and we wave goodbye. Just know the door is always open for us to continue to offer support.
No, that's great to know. Thank you for sharing. We had a question come in. Maybe Lisa can answer this one, asking, are coaching sessions during the day or can they be scheduled at a non-work time? So what's the flexibility with scheduling the sessions with coaches?
That's a great question. So once a referral is made from the Hopscotch office to a coach, the coach will call the participant, and in an introductory phone call where we get to know a little about the participant's interest and the participant gets any questions that they have answered, one of the topics we discuss is scheduling. And if a person is working or has shifts or timing that we need to work around, we do that. If somebody has a fixed schedule, then we try to set it up so that each week we have the same day and time. That's just advantageous for anybody with memory issues to know that Mondays at 3, that's Hopscotch time, and it doesn't bounce around a lot. But things happen even when we set our schedule nicely fixed. People have seizures, people have holidays, people have good gracious COVID. We are maximally flexible as long as we are, not letting lots of time go by between sessions, because we really want to get some momentum and build on the fundamentals that we're working on. But typically we complete 8 sessions in, 10 weeks. 8 for 8 is unusual because things do come up, but we do have scheduling flexibility and reschedulable time if we need to.
Thank you. That's really helpful with knowing how to, fit the program into your schedule and, before signing up. I know that's always an important thing to consider and factor to think about.
I would think that would not be a disincentive. That would be something that could be worked around if it was a concern for people.
Yeah. And then I want to ask, we're getting a little short on time here, so I want to make sure this last question here gets answered. And I've heard the enthusiasm come from both Joanne and Scott, but I also want Lisa to be able to touch upon this. Elaine has shared it already. But we'll start with Joanne. What advice or encouragement, might you give someone who is thinking about trying the Hopscotch program?
Well, just like I said about myself, I think that I thought about it, and I thought the only thing that it would do was help me. And if you do the Hopscotch program, I think the more you put into it, the more you'll get out of it. So it's really, really important to do that work, to do the homework that you talk to your coach about, to really try, which I find extremely helpful, the relaxation techniques. I love them. It just clears my mind and I feel like I can just start all over again. So it's so worthwhile just to do that for yourself instead of worrying about everyone else.
No, thank you for sharing that.
You're welcome.
And Scott?
Yeah. So, sorry, what was the question one more time? I got caught up and that was a really cool.
I know, I'm like, what advice or encouragement would you give a person who's thinking about trying the Hopscotch program?
Oh my gosh, just do it. There's no downside to it. The amount of expertise and knowledge that these folks can bring to the table in understanding your epilepsy. They understand epilepsy. They understand memory. So you're 2 for 2 right there. And they're nice people. They have these great amount of resources. The memory book right here. Lisa, I'm gonna show them what my first two look like. So this is like what my first two homework assignments look like. Yeah, it's you get filled up, you get caught up in them, and it's really great to be that enthusiastic about them, to say that this person one-on-one understands me, and for the next 2 months is going to know what is really bothering me and can help bring me some tools, can bring me the tools to focus, to overcome these tools, or not necessarily overcome them, but to just carry me through them. So when I can't remember what to do, I've got some other compensatory tools to go past them. And that's been really, really helpful. So I would say, if you're thinking about it, go ahead and do it. And I think you'll be really pleasantly surprised about what you get out of this program.
Thank you. I know I'm ready for that booster to sign up again. You guys are you've encouraged me already to do it. We had one question come in before we go to you, Lisa, a very important one. Is there a cost to the program? And I'll go to Elaine for that one.
Yep. So there's no cost to participate in the program, and there are no costs for the materials. So we work hard to write grants and partner with the Epilepsy Foundation and other epilepsy organizations to be able to provide the program. And we have support from the Epilepsy Center at Dartmouth as well, to make sure that anyone, anywhere can access the program if they would like to, at no cost. So no cost.
Thank you. And you got a very big wow in the chat for that response. But yeah, the program, as Elaine said, like to make it as accessible as possible to members of the community. So, and then I do want to give, Lisa, your chance as a coach to offer your perspective. What advice or encouragement would you give someone thinking about joining the program?
I'll echo Joanne and Scott. Try it. What is there to lose? We are ready. We are interested. We are capable. We can provide some basic lift all boats suggestions, like better sleep helps everything. We can provide specific suggestions for specific issues that are more targeted. We will enjoy ourselves. We will not be surprised by anything you present us, and we will do our very best to help. So think it over and give us a try.
Thank you so much. I know we have a few more minutes left, so Elaine had one more slide she wanted to pull up for everyone. So let her pull that up.
Great. Thank you, Allison, for allowing me to thank the people that joined us this evening, to thank you and your team at the Epilepsy Foundation for partnering with us to make this program accessible. So the helpline at the Epilepsy Foundation can help to direct you to us. You can go to hopscotch.org. If you live in a state that has an affiliate or a chapter, many of them also provide the program, and we're so pleased to have them as part of our team. And so if you're interested in participating locally, you can, check through your local Epilepsy Foundation or Epilepsy Alliance as well to see whether or not it's available close to home. But if not, do not fret. We deliver hopscotch all over the country, all over the world to people who are interested. So from that aspect, telehealth has been amazing at helping to build access for people everywhere. So thank you again. I want to thank Lisa and Scott and Joanne for all the valuable information they've shared. And thank you, Allison, and the foundation.
Thank you, everyone. I'm going to pull up one last slide here. We also like to share at the end of our webinars about our seizure first aid certification program that we offer. If you're not familiar with that, you can learn more by going to epilepsy.com/first aid to learn more. and, get you and your friends and your family seizure first aid certified to, help make the community safer and yourself safer by getting those around you certified in seizure first aid. So if you haven't done that yet, you can do that. But, thank you for joining us. Thank you to Elaine, Scott, Lisa, and Joanne for being here with us this evening and spending some of your night with us. I know we had someone from Ireland where it was 1 a.m. So we had people from all over with us tonight. So thank you. And I hope you all have, a wonderful rest of your evening. And if you have any questions, you can always reach out to us at the Epilepsy Foundation and we'll get you connected to the folks at the Hopscotch Institute. So thank you so much.
Thank you.